Dr. Frank, thank you so much for being here with us, especially during this
Thank you.
recovery time. How are you feeling, first of all?
I'm in recovery. Even though I'm about 7 days out without fever, I think my brain is expecting a much quicker recovery than my body is. I'm
Right.
so used to being an active person. And I have to say, I'm finding this from all the other people I know that went through the same thing. It's just a slow recovery. It doesn't mean that you actively have the virus, but obviously it caused inflammation and damage that really requires healing. So
Right.
I'm trying to get as much activity as I can, but also resting.
So let's start then from the very beginning. What were the first symptoms? How did you realize that you had COVID-19?
I was working in the office the last few days as before they told everybody to kind of shut down. I think most doctors' offices and most businesses were kind of wrapping things up. And I was exhausted. I wasn't sleeping. I was stressed about real life stupid issues like staff and money and patients and all these things.
Right.
But really, on that last day of work on that Thursday, I was like, I got hit by a wall of fatigue. And the next morning I woke up with 103.5 fever. So fever for me was really the first symptom. And I think that's the most common diagnostic symptom of what people are seeing now. I really waited 2, 3, 4, 5 days of super high fevers, headaches, body aches, chills, sweating, until all of a sudden that second wave came and I started coughing and having breathing difficulties. And that's when I knew. That's when I knew I had COVID. Now, this whole 2-stage process, no one really knew about back then. And I was still living under the assumption that I'm a healthy 50-year-old, active, fit person. Like there's no issue here.
So it was the fever, then the breathing was what you felt.
Yeah.
Right?
Yeah.
And then
Yeah.
what came after that for you?
That's it. Just the terror. That was enough. Breathing, coughing, and fever. I had 12 days straight fever. The first 5 days were up to 103.5, and then it was like 101 to 102. But it just didn't stop. It didn't relent. And I think out there, I get so many questions on social media about like, when do I need medical attention? And nothing else matters other than the breathing. The breathing is the only thing that matters in this. Whether you have sinusitis or bronchitis or just a cough or fever or chills or diarrhea, the symptoms don't matter other than the lung ones. And that's what we have to remember, because we don't want to overburden our hospitals too.
Phase 1 then was those specific symptoms that you listed. What was phase 2 like for you?
Phase 2 is really where a lot of the anxiety kicked in, because you're like, this is it. I have the pneumonia. Can potentially die here. Being a doctor also, I had that little pulse ox. I'm following my oxygen levels. They were getting dangerously low. Yeah. I was fortunate enough to have access to oxygen from my private medical office. I was using that to help me. And, it was 3 days of really touch and go about whether or not I was going to go to the hospital or not. If I wasn't a physician, I probably would have recommended to me to go. But like I said, I had nebulizers, asthma medicine that helped me breathe, and I had the oxygen. And, I think aside from the medical oxygen, there are certain things that people should have in their house to make sure that if they get it, they're going to be okay.
Let's talk about that for a second. What are some
Yeah.
of the tools? What are some of the things that you took? I heard you say Tylenol as well in one video.
Yeah, listen, through any illness, the number one thing you need is your strength. The number one cause of worsening of illness is dehydration and bedridden lethargy. So keeping high caloric drinks like Gatorade and Pedialyte, anything to get calories in you. Calories and fluid. High caloric fluids. It's nice, especially if you have any history or anyone in your home has a history of lung issues. It's nice to have that prescription of albuterol nebulizer, because in my darkest times of the breathing, that did give significant relief, because you just can't feel like you can get air.
Right. And you also talked about an oxygen tank that you were able to get.
Yeah. That's not something people are going to do. And by no means, it was probably stupid of me to be my own doctor. But, I am trained in advanced life support and I know how to use oxygen. But, that's not something that the average person is going to be able to access. They
Right.
will be able to access Tylenol, Gatorade. They will be able to get their hands on a pulse oximeter. I've given a simple guide of what's safe and what's dangerous in terms of those numbers on my Instagram. And I think having access to the asthma medicine is very important. And I think if you're sick and you're having breathing problems and the asthma medicine helps you, you're good. If you find that it doesn't respond and your pulse oximeter is still showing low numbers, that's when you have to go to the hospital. We need to save our resources for those people on the front lines who are really ill, but we also have to recognize when we need help. And the breathing issue is the main one.
Switching gears a little bit to mental health. I know that Governor Cuomo put out yesterday, we partnered up with Headspace to provide a free meditation, anxiety app that will help during that time. I know that you talked about during phase 2 that you felt there was more anxiety that week. Can you talk a little bit about that? And if you felt lonely and what that process was like for you?
Anxiety is a very mild word. It was really nothing short of terrifying. You really don't have any access to your family other than FaceTime. You know what I mean?
Right.
And really, I wasn't sleeping more than 20 minutes at a time because I would fall. You got to realize we passively breathe 24 hours a day. When you're consciously making an effort to breathe and you fall asleep, you wake up gasping for air. It's terrifying.
Yeah.
I've been doing transcendental meditation for 7 years, twice a day without fail, 7 days a week. It was difficult for me to meditate because it allowed me to focus on my breath and almost relax. And sometimes that's not what your body needed. You're trying to make an effort to breathe. Aside from prayer, I like listen to audiobooks of like my most inspirational people. Mm-hmm. That's really it. And try and have as much contact with your family as you can through FaceTime and conversation and watching TV and doing things to take your mind off of it, because people don't realize that the worst symptom of this disease is breathing. And the number one thing that worsens breathing is anxiety.
I want you to talk about this a little bit because there's a lot of people walking around that don't have any symptoms, that are asymptomatic right now. And I've heard you say before, treat yourself as if you have it, and interact with people as if you have it. Practice social distancing as if you have it. We have 2 major holidays coming up, Easter and Passover. What can you say to that, and what advice can you give, especially as a patient that just went through COVID?
Yeah, I mean, one word, Zoom. You have to celebrate, religious holidays are important. God knows we need them now more than ever. But they have to be done together, yet apart. And people just cannot risk it. They cannot risk around being around their elders. And just because you feel well, we still have to stay inside as much as possible. We need to get out for exercise. We need to get essentials, but we have to be smart about this and realize that so many of the religious holidays amongst all religions exist because of the tough times that the people of that religion have gotten through. And we have to realize that now more than ever during those religious holidays, we have to get through these times. And that's by just playing smart.
How are you feeling now? Have you been retested?
Yeah, you know what? I just got my first test because I wasn't able to leave my house. I didn't want to risk anybody.
Right.
So I just got my first test results in. It is negative. Both my wife and I are negative. So my dog could lick me again. And my children were willing to hug me. And my wife was willing to kiss me. So I couldn't be happier. I am waiting for the antibody tests. What I had was the mRNA test to test if I have active virus. That's the common one out there. We're all waiting for the antibody test because once I can prove myself immune, then I'm going to donate my blood and I'm going to do whatever I can if I have the strength to get on the front lines, because that's good of the way, not only that we're going to get our healthcare providers through this and the sick people, but it's also going to be a way that we're all going to get back to life by getting the immune people out there first.
Right. I actually agree with that. There's something that we are kind of talking about. I've heard ramblings at the UN where creating kind of like how they have the Peace Corps, similar to that, having the people that have created antibodies in their system by going through COVID be the frontliners, be the ones that are taking care of people, because you can't have an army that goes to war that half of the army is being taken.
Yeah, and people are getting, the healthcare workers are getting sick.
Right.
They say 1 in 5 or 1 in 6 of the police force has COVID.
Right. Exactly.
You know,
And
so it's time to replace, to shift it out.
yes, I 100% agree. Thank you so much for your time. Thank you so much for your
pleasure.
wealth of knowledge. I am so happy that you're so much better.
Thank you.
Give my love to your family, and I hope that you have even more of a speedy recovery, getting all of your energies back and being able to share this information that you have with us today with everyone.
Thank you so much. Stay safe and healthy. Bye-bye.
Thank you. Bye-bye.